Hello and welcome back. My name is Patrick Massey, and this is episode 3 of my lecture series on breast cancer and high-dose vitamin C. In this particular episode, I'm going to be speaking about the quality research that's available in the traditional medical literature on the use of high-dose vitamin C and its effect on survival of patients with breast cancer. Now, I know that there's a lot of theory out there as to whether or not vitamin C is important, whether or not vitamin C is effective. And theory and opinion is all very good, but where is the research? Well, where is the real medical evidence? And in reality, there's actually a number of good studies that show that high dose vitamin C is quite effective. So let's really get into it and start looking at some of the medical research studies. However, before we start, we need to understand that there are issues with any clinical research. One of the issues has to do with standardization of research protocol. There are in almost every illness known to man, there is rarely any real standardization of research protocol. Everybody does something a little bit different. Everybody is looking at the research a little bit differently. They're trying to answer maybe slightly different questions. And so there really has to be an interpretation of the results of research based upon the variation in protocol. One of the variations has to do with the severity of illness. Patients who are very ill tend to have a very different outcome than patients who are not quite as ill. Also, there are issues with the length of treatment as well as the dose of treatment. These have not been standardized, especially with high-dose vitamin C. There's a lot of opinion. And then there's the issue of oral vitamin C versus intravenous vitamin C. Now, there are some studies showing that oral vitamin C may have an effect on breast cancer. There are definitely studies showing that intravenous vitamin C has an effect. But if you're comparing oral and intravenous, remember from my first lecture that oral vitamin C acts as an antioxidant and has a different outcome than the intravenous that acts as a pro-oxidant and has a different outcome. And then there's always the issue of are you doing vitamin C with or without chemotherapy? Which chemotherapies are you using? Or radiation therapy? Are you using it in combination with chemotherapy and radiation therapy, or just radiation therapy alone? So the protocols can become quite complex and complicated. And this is another difficulty with really any kind of clinical research. And so consensus can be very slow. However, we can move around consensus with informed opinion and interpretation of the research that's already out there. So let's just look at does intravenous vitamin C have any effect at all? So let's just look at vitamin C in reducing the severity of the side effects of chemotherapy and radiation therapy. This was a study done in the medical journal In Vivo in 2021. And what they found is that there's a number of different side effects that can happen with cancer therapy: nausea, diarrhea, vomiting, loss of appetite, depression, sleep disorders, cachexia, which means weight loss, inflammation of the mucous membrane, skin reactions. And what they found is that those who were getting high-dose vitamin C has significantly reduced symptoms of nausea and loss of appetite. The tumor pain got better, headaches got better, big jump in energy levels, big reduction in depression, and a big reduction in sleep issues. And this is just for the side effects of the chemotherapy itself. So high-dose vitamin C outside of breast cancer itself is actually having an effect on how the body is able to handle chemotherapy and radiation therapy. Let's look at survival in vitamin C. We're looking at it in two different ways. The European Journal of Cancer 2014 did a meta-analysis. A meta-analysis is one way of combining a number of medical studies to come up with better statistics. And in this meta-analysis, what they had is they had over 17,000 breast cancer patients and over 1,500 cancer-specific deaths in that group. And what they found is that oral vitamin C, dietary vitamin C acting as an antioxidant, resulted in a statistically significant reduction of both total mortality as well as breast cancer specific related mortality. Total mortality being heart disease and diabetes and sudden death. Now, vitamin C affects more than just than just breast cancer. So it may have an effect, as we saw earlier in the slide earlier, at some of the symptoms, allowing the body to be stronger. In a medical journal of clinical breast cancer 2021, another meta-analysis looking at 6 studies found that starting vitamin C after the diagnosis significantly increased survival of the patients. And then a study done in the same year in nutrition and cancer, that vitamin C, again, given after the diagnosis, significantly longer survival and fewer recurrences. In the journal Alternative and Complementary Medicine 2020, they looked at the dose of high dose intravenous vitamin C during radiation therapy in breast cancer patients on the neutrophil lymphocyte ratio. And what the neutrophil lymphocyte ratio is, the NLR, it's a measure of systemic inflammation. Not all doctors order this on their breast cancer patients. They should, because it's a good way of seeing how inflamed their patients are. Systemic inflammation is common with radiation therapy, even if it's localized radiation therapy. And we know that systemic inflammation stimulates cancer stem cells. High-dose vitamin C reduces inflammation, especially along the NF-kappa B pathway and the activity of cancer stem cells. So a higher NLR relates to a greater mortality in breast cancer patients. So if you have your NLR checked and it's elevated, and there's some interpretation as to what an elevated NLR is, there's still some research going on in this area, but it's a good marker really to see how your patients are actually doing. And the NLR is significantly lower during radiation therapy if patients are also being given high-dose vitamin C. And what this does is it affects the inflammation pathways. Another study in integrative cancer therapies 2020 looked at a retrospective study, which means that they're looking back on charts. It's not a prospective study where they recruit patients, looking at the effect of patients with advanced triple negative breast cell cancer. They were all stage 4, and they were all taking either taking gemcitabine and carboplatin, either with or without intravenous vitamin C. What they found is that on progression of free survival, the chemotherapy alone was only 4.5 months, but if you added vitamin C, it almost doubled that to 7 months. And again, this is in advanced disease. The median overall survival for chemotherapy alone was 18 months. And and if you added vitamin C, you added almost another year to it. And again, in patients with less advanced triple negative cancer, with the results that have been even more impressive. And I'm probably guessing that the answer would be yes. In the Journal of Translational Medicine, 2012, looking at the effect of high-dose vitamin C on inflammation in cancer patients. So again, we're looking at inflammation markers. And high-dose intravenous vitamin C lowered CRP, or C-reactive protein, which is a very common marker of chronic inflammation. Can be very sensitive, and a number of other inflammatory markers, some of the interleukins and other pro-inflammatory cytokines. And this decrease correlated with the decrease in tumor markers, and with the decrease in tumor markers, that there was actually a longer survival. So you would imagine that if the tumors are not making as many markers because the tumors are not able to, that a patient would survive longer, and apparently that's the case. Anti-cancer research, 2019, high-dose vitamin C combined with anti-cancer treatment on breast cancer cells. This was something that was done in the laboratory on breast cancer cells, and what they found is that when you added vitamin C, even small amounts of vitamin C, to breast cancer cells in the test tube, it had a dramatic effect on the viability of these cancer cell lines. They died more rapidly. And when you added vitamin C and chemotherapy agents or endocrine agents like tamoxifen or biologic therapies, when you added vitamin C to these different therapies, that the death of the breast cancer cells was significantly more than simply the therapies alone, indicating that vitamin C plays well with chemotherapy and biologic therapies. This was a phase 3 study looking at high-dose vitamin C plus chemotherapy on stage 4, on severe stage 4 colorectal cancer, and then the results are impressive for really the last line in this slide, in that the progression-free survival of the experimental group was not superior to control, which means that people treated with vitamin C didn't survive any longer than people who were just getting chemotherapy. A little disappointing. However, in one sub group, a RAS mutation in the colorectal cancer cell resulted in significantly longer survival with vitamin C plus chemotherapy. Now, this is the important part, is that these patients were only treated for 3 days with vitamin C. It was a very, very short length of time that these patients were treated with vitamin C, and it was a relatively low dose compared to the usual doses. So even with a short-term exposure at a lower dose, some of these patients did have better survival. High-dose vitamin C will actually sensitize chemotherapy. We know that in Journal of Urology 2006, vitamin C, significant effect on anti-proliferative and apoptotic effects, which means that it stopped the cancer cells from proliferating and stimulated their death. And it also enhanced the efficacy of a chemotherapy agent, gemcitabine, against bladder cancer in vivo, which means in humans. Cancer Letters, 1996. Vitamin C improves the effect of chemotherapy drugs doxorubicin, cisplatin, and paclitaxel on human breast cancers. This was done in a test tube. It was done in vitro, but again, it shows the additive effect of adding vitamin C to the efficiency of these chemotherapy regimens. And in another study in cytotherapy 2015 is that vitamin C promotes increases in natural killer cells. And natural killer cells are white blood cells that go around the body looking for cancer cells to kill. And then there's a lot of research showing that increases in natural killer cells leads to cures and longer survival. So the questions as far as vitamin C goes is really, what's the optimal dose? It's unknown. Anywhere between 25 to 50,000 milligrams once a week seems to be prudent based on the clinical applications that are being done out there, and the clinical results. How often and how long is really unknown. We have seen in one of the studies that even a very short course of vitamin C seems to have some benefit. How long do you need to be doing it? It's not known. I have had patients do intravenous vitamin C for a very long period of time, and are really at the fall outside of the statistics for survival for their particular breast cancer, so surviving way longer than they would have based on statistics. Is it offered? Well, not many oncologists or medical centers offer in intravenous vitamin C, and so you need to kind of you need to look around. And the cost will vary upon dose and clinic location. So clinics that are located in towns or cities where the population has more disposable income, it may be more expensive than in locations where the average income is less. And is it safe? And the answer is yes. If you have kidney stones, however, it may increase your chance of having more kidney stones, and it shouldn't be done in patients with hemochromatosis or patients with a condition known as G6PD deficiency. I forgot to put that on the lecture, but those are very, that condition is very rare, as is hemochromatosis. Is it preventative? We just don't know. What we do know is that when women are diagnosed with breast cancer, they have a much lower level of vitamin C than the usual population. So there is a suggestion that there may be some preventative benefit to it. So here are the key takeaways from all three lectures combined. Cancer stem cells are bad. Cancer stem cells are the cells that metastasize. They are the cells that develop resistance to chemotherapy. They develop resistance to radiation therapy. They are probably the main reason for the mortality associated with breast cancer. Traditional medicine has nothing for cancer stem cells outside of radiation therapy and chemotherapy, and in doing so, there's a possibility that you actually may be selecting for those cancer stem cells that are more resistant. So you actually may be making things selecting for a more resistant form of breast cancer. It does not mean do not do radiation therapy and chemotherapy. It just means we need to add a few things to make it more effective. High dose vitamin C negatively impacts cancer stem cells. We know that. There's a lot of good research out there on that, and the results are quite positive, especially the effect that it has on the NF-kappa B inflammation pathway. High dose vitamin C is also complementary to most chemotherapies and most radiation therapies. It's not universal, so you need to really check with the physician who's prescribing the high dose vitamin C to make sure that it's not contraindicated with the chemotherapy. There are a few cases, and it's primarily in liver cancer rather than breast cancer. So one of my favorite quotes is that without deviation, progress is not possible. And high dose vitamin C therapy is deviating from the norm, but the results seems to be a step forward in our understanding of how to treat breast cancer. So I want to thank you for watching my lectures. I hope you enjoyed them. I hope you got good information from them, and I wish you all success in your health journey. If you want more topics blending the best of traditional and non-traditional medicine, please follow me on YouTube. That would be youtube.com/ALTMED1544. I have some lectures on there. I also have a video of my youngest son catching his first collegiate touchdown. And please feel free to sign up for my newsletter or blog. There's a QR code to the right. You can use that, or you can go to my website at alt-med.org. You can sign up there. If you have questions about these lectures, please feel free to email me at am4011@juno.com. I answer all of my emails. I don't have somebody else answering them. So again, thank you very much for your time and your consideration, and the best of health to all of you.